ASA Classification and Anesthesia. An overview of ASA classification and its role in anesthesia management. ASA Classification and Anesthesia. Understanding the system. Welcome to our discussion on ASA classification and its crucial role in anesthesia management. The American Society of Anesthesiologists (ASA) Physical Status Classification System is a widely used framework that helps anesthesiologists assess a patient's physical health before surgery. This system plays a vital role in determining the risks associated with anesthesia and guiding anesthesia care. Let's dive into the ASA classification system and explore its significance in ensuring safe and effective anesthesia management. Understanding the ASA classification system is essential for anesthesia professionals to provide optimal care and minimize risks for patients undergoing surgery. ASA classification. Assessing patient risk. 1. Purpose of ASA classification. 1. Assessing physical status. The ASA classification system evaluates a patient's overall health and physical status. 2. Predicting anesthesia risk. It helps predict the risks associated with anesthesia and guides anesthetic management. 2. Importance of ASA classification. 1. Categorizing patients. Patients are categorized based on their overall health and comorbid conditions. 2. Guiding anesthesia care. ASA classification system provides guidance for anesthetic management and helps minimize risks. 3. Benefits of ASA classification. 1. Improved patient safety. By assessing patient risk, ASA classification helps ensure safe anesthesia care. 2. Enhanced anesthesia planning. It enables anesthesiologists to develop a tailored anesthesia plan based on the patient's physical status. The ASA classification system is a valuable tool for assessing patient risk and guiding anesthesia care. ASA 1. Healthy patient. 1. Definition. 1. Normal, healthy individual, patients with no known medical conditions or systemic diseases. 2. No systemic diseases. Patients in this category do not have any underlying health issues. 2. Anesthesia management. 1. Routine, low-risk anesthesia. Anesthesia care for ASI patients is typically straightforward and low risk. 2. Example, a healthy young adult undergoing minor surgery, such as a routine appendectomy or hernia repair. 3. Characteristics. 1. No underlying health issues. Patients in this category are generally fit and healthy. 2. Low risk for anesthesia complications. ASI patients are at a lower risk for anesthesia-related complications. ASI patients typically require standard anesthesia care, and their healthy status makes them a lower risk for anesthesia-related complications. ASA 2. Mild systemic disease. 1. Definition. 1. Mild systemic disease. Patients with mild systemic disease that is well controlled and does not significantly impact daily life. 2. Does not limit normal activity. Patients in this category are able to perform normal activities without significant limitations. 2. Examples. 1. Well-controlled hypertension. Patients with high blood pressure that is managed through medication or lifestyle changes. 2. Mild asthma. Patients with asthma that is well controlled and does significantly impact daily life. 3. Non-insulin dependent diabetes. Patients with diabetes that is managed through diet, exercise, or oral medication. 3. Anesthesia management. 1. Minimal impact on anesthesia. The presence of systemic disease has a minimal impact on anesthesia management. 2. Standard anesthesia care with adjustments. Anesthesia care may require slight adjustments to account for the patient's underlying condition. ASA 2 patients typically require standard anesthesia care with minor adjustments to account for their underlying condition, and their mild systemic disease does not pose a significant risk for anesthesia-related complications. ASA 3. Severe systemic disease. 1. Definition. 1. Severe systemic disease. Patients with significant health issues that impact daily life and limit normal activity. 2. Limits activity. Patients in this category experience significant limitations in their daily activities due to their condition. 2. Examples. 1. Stable angina. Patients with chest pain due to coronary artery disease that is managed with medication. 2. Poorly controlled hypertension. Patients with high blood pressure that is not adequately managed through medication or lifestyle changes. 3. Moderate obesity. Patients with a significant amount of excess weight that may impact their overall health. 3. Anesthesia management. 1. Additional monitoring. Patients in this category require closer monitoring during anesthesia to ensure their safety. 2. Specialized management strategies. Anesthesia care may require additional strategies to manage the patient's underlying condition and minimize risks. ASA 3 patients require careful anesthesia planning and management due to their systemic disease, which may pose significant risks during anesthesia. ASA 4. Severe systemic disease, constant threat to life. 1. Definition. 1. Severe systemic disease. Patients with severe and unstable health issues that pose a significant threat to their life. 2. Constant threat to life. Patients in this category high risk of serious complications or death due to their condition. 2. Examples. 1. Recent myocardial infarction. Patients who have had a recent heart attack. 2. Severe COPD. Patients with severe chronic obstructive pulmonary disease that significantly impacts their breathing. 3. Severe renal failure. Patients with severe kidney failure that requires dialysis or transplantation. 3. Anesthesia management. 1. Careful anesthesia planning. Patients in this category require detailed planning and preparation for anesthesia. 2. High-risk anesthesia care. Anesthesia care is high risk due to the patient's severe systemic disease. 3. ICU monitoring post-op. Patients often require close monitoring in the intensive care unit, ICU, after surgery. ASA IV patients are critically ill and require careful anesthesia planning and management to minimize the risk of serious complications or death. ASA 5. Moribund, not expected to survive without surgery. 1. Definition. 1. Moribund state. Patients who are critically ill and unlikely to survive without surgical intervention. 2. Not expected to survive without surgery. Patients in this category are at high risk of death without surgery. 2. Examples. 1. Multiple organ failure. Patients with failure of multiple organs, such as the liver, kidneys, and lungs. 2. Terminal cancer. Patients with advanced cancer that is no longer responsive to treatment. 3. Anesthesia management. 1. High-risk surgery. Surgery is considered high risk due to the patient's critical condition. 2. Last resort. Surgery is often performed as a last resort to try to save the patient's life. Careful consideration. Anesthesia care requires careful consideration of the patient's condition and the potential risks and benefits of surgery. ASA 5 patients are critically ill and require careful consideration and management due to their high-risk status and the potential for poor outcomes. ASA 6. Brain dead patient, organ donation. 1. Definition. 1. Brain dead patients. Patients who have been declared brain dead and are being maintained on life support for organ donation purposes. 2. Organ donation. Patients in this category are donors of organs for transplantation. 2. Anesthesia management. 1. No anesthesia for survival. Anesthesia is not required for the patient's survival, as they are brain dead. 2. Anesthesia for organ harvesting. Anesthesia is used to facilitate organ harvesting and ensure the quality of the donated organs. 3. Special considerations. Anesthesia care is focused on preserving the health and function of the donated organs. 3. Purpose. 1. Organ donation after brain death. ASA classification is used in cases where organ donation occurs after brain death has been declared. 2. Facilitating organ transplantation. The goal of anesthesia care in these cases is to facilitate successful organ transplantation. ASA 6 patients are brain-dead individuals who are being maintained on life support for organ donation purposes, and anesthesia care is focused on ensuring the quality and viability of the donated organs. ASA classification in clinical practice. 1. Preoperative assessment. 1. Evaluating patient risk. ASA classification is used to evaluate a patient's physical status and risk level before surgery. 2. Guiding anesthesia care. The ASA classification helps anesthesiologists develop a plan for anesthesia care. 2. Guiding anesthesia management. 1. Drug choice. ASA classification helps guide the choice of anesthetic drugs and techniques. 2. Monitoring. The ASA classification also guides the level of monitoring required during surgery. 3. Determining risk level. 1. Predicting complications. The ASA classification helps predict the risk of complications during surgery. 2. Risk stratification. It allows anesthesiologists to stratify patients according to their risk level and develop a plan to minimize risks. The ASA classification is a valuable tool in clinical practice, helping anesthesiologists assess patient risk, guide anesthesia management, and minimize the risk of complications during surgery. Benefits of ASA classification. 1. Standardizes risk assessment. 1. Consistent evaluation. The ASA classification provides a standardized system for evaluating patient risk. 2. Applies to all patients. It ensures that all patients are assessed in a consistent and reliable manner. 2. Patient communication. 1. Informing patients. The ASA classification helps anesthesiologists communicate with patients about their surgical risks. 2. Setting expectations. It enables patients to understand risk level and what to expect during surgery. 3. Planning anesthesia and postoperative care. 1. Tailoring anesthesia care. The ASA classification helps anesthesiologists plan and tailor anesthesia care to the patient's needs. 2. Postoperative planning. It also guides planning for postoperative care and management. 4. Resource allocation. 1. Emergency preparedness. The ASA classification supports resource allocation in emergency situations. 2. Prioritizing care. It helps care teams prioritize care and allocate resources effectively. The ASA classification provides numerous benefits, including standardizing risk assessment, improving patient communication, guiding anesthesia and postoperative care, and supporting resource allocation. Limitations of ASA classification. 1. Subjectivity. 1. Clinician's assessment. The ASA classification is dependent on the clinician's subjective assessment of the patient's condition. 2. Variability in scoring. Different clinicians may assign different ASA scores to the same patient. 2. Nonspecific. 1. Limited consideration of specific conditions. The ASA classification does not account for certain specific conditions, such as organ function or severity of disease. 2. Broad categorization. It provides broad categorization of patient risk, but may not capture all relevant factors. 3. Lack of consideration of lifestyle factors. 1. Age not considered. The ASA classification does not incorporate age as a factor in risk assessment. 2. Smoking lifestyle factors not accounted for. Other lifestyle factors, such as smoking, are also not considered. 4. Limited predictive value. 1. May not predict specific complications. The ASA classification may not predict specific anesthesia complications such as airway difficulty. 2. Limited guidance for certain situations. It may not provide sufficient guidance for certain complex or high-risk situations. The ASA classification has several limitations, including subjectivity, nonspecificity, lack of consideration of lifestyle factors, and limited predictive value. These limitations highlight the need for careful consideration and clinical judgment when using the ASA classification. ASA and preoperative risk assessment. 1. Identifying high-risk patients. 1. Risk stratification. The ASA classification helps identify patients at high risk for surgery-related complications. 2. Targeted care. It enables anesthesiologists to provide targeted care to high-risk patients. 2. Determining optimal perioperative care. 1. Personalized care. The ASA classification helps anesthesiologists determine the optimal perioperative care plan for each patient. 2. Tailored approach. It allows for a tailored approach to patient care, taking into account the patient's specific needs and risks. 3. Influencing decisions. 1. Surgical urgency. The ASA classification influences decisions on surgical urgency, helping determine whether surgery should be or expedited. 2. Patient management. It also influences patient management, including decisions on monitoring and interventions. 3. Monitoring and interventions. The ASA classification guides decisions on the level of monitoring and interventions required during surgery. The ASA classification plays a critical role in preoperative risk assessment, enabling anesthesiologists to identify high-risk patients, determine optimal perioperative care, and make informed decisions about surgical urgency and patient management. Anesthesia management based on ASA class. 1. ASA I. 1. Standard anesthesia care. Patients with no underlying health issues receive routine anesthesia care. 2. No special considerations. Anesthesia management is straightforward, with no additional precautions needed. 2. ASA 2. 1. Monitor and optimize comorbidities. Patients with mild systemic disease require monitoring and optimization of their comorbidities. 2. Routine care with adjustments. Anesthesia care is routine, but with adjustments made to account for the patient's underlying condition. 3. ASA 3 and IV. 1. Invasive monitoring. Patients with severe systemic disease require more invasive monitoring to ensure their safety during surgery. 2. Potential ICU care post-op. These patients may require intensive care unit (ICU) care after surgery to manage their condition. 4. ASA V. 1. High-risk surgery. Patients who are critically ill and require surgery as a last resort are at high risk for complications. 2. Careful monitoring. These patients require careful monitoring during surgery to minimize risks. 3. Post-op ICU management. After surgery, they will likely require ICU care to manage their condition and prevent complications. The ASA classification guides anesthesia management, with the level of care and monitoring tailored to the patient's specific needs and risk level. Postoperative care for high ASA class. 1. ICU care for ASA 3 and IV patients. 1. Close monitoring. Patients with severe systemic disease often require intensive care unit (ICU) care after surgery. 2. High-level care. ICU care provides a high level of monitoring and intervention to manage potential complications. 2. Monitoring. 1. Vital signs. Close monitoring of vital signs, such as heart rate and blood pressure, is crucial. 2. Respiratory function. Monitoring of respiratory function helps ensure adequate oxygenation and ventilation. 3. Cardiovascular status. Close monitoring of cardiovascular status helps identify potential complications. 3. Pain management. 1. Crucial for recovery. Effective pain management is essential for recovery and patient comfort. 2. Multimodal approach. A multimodal approach to pain management may be used, incorporating different medications and techniques. Postoperative care for high ASA class patients requires close monitoring, ICU care, and effective pain management to ensure a smooth recovery and minimize complications. ASA and surgical risk stratification. 1. Stratifying surgical risks. 1. Risk assessment. The ASA classification helps to assess the risk of surgical complications based on the patient's physical status. 2. Identifying high-risk patients. It enables healthcare providers to identify patients at higher risk for complications. 2. Guiding surgical planning. 1. Resource allocation. The ASA classification guides surgical planning and resource allocation, ensuring that high-risk patients receive adequate care. 2. Anticipating complications. It helps healthcare providers anticipate potential complications and develop strategies to mitigate them. 3. Influencing surgical decisions. 1. Choice of surgical techniques. The ASA classification may influence the choice of surgical techniques, with more conservative approaches used for high-risk patients. 2. Anesthesia modalities. It also influences the choice of anesthesia modalities, with careful consideration given to the patient's underlying condition. The ASA classification plays a critical role in surgical risk stratification, guiding surgical planning, resource allocation, and decision-making to ensure optimal patient outcomes. ASA and decision to operate. 1. Preoperative optimization. 1. Careful consideration. For patients with ASA 3 or higher, careful consideration of preoperative optimization is necessary to minimize risks. 2. Stabilizing the patient. Preoperative optimization may involve stabilizing the patient's condition before surgery to improve outcomes. 2. Emergency cases. 1. Influencing the choice of intervention. In emergency cases, the ASA classification may influence the choice of intervention, with a focus on the most effective and safest approach. 2. Balancing risks and benefits. The decision to operate must balance the risks and benefits of surgery, taking into account the patient's ASA classification. 3. Postoperative care. 1. More intensive care. Patients with higher ASA scores require more intensive postoperative care to manage potential complications. 2. Close monitoring. Close monitoring and aggressive management of postoperative complications are essential to ensure optimal outcomes. The ASA classification plays a critical role in the decision to operate, guiding preoperative optimization, surgical decision-making, and postoperative care to ensure the best possible outcomes for patients. Practical application of ASA classification. 1. Selecting anesthetic technique. 1. Tailoring anesthesia care. The ASA classification helps select the most suitable anesthetic technique based on the patient's condition and risk level. 2. Patient-specific approach. Anesthesia care is tailored to the individual patient's needs, taking into account their ASA classification. 2. Anesthetic management. 1. Drug dosages. The ASA classification informs anesthetic drug dosages, with careful consideration given to the patient's underlying condition. 2. Airway management. It also guides airway management strategies, ensuring that patients receive the most appropriate care. 3. Monitoring strategies. The ASA classification influences monitoring strategies, with more intensive monitoring used for high-risk patients. 3. Perioperative care. 1. High-risk patients. The ASA classification guides perioperative care, especially for high-risk patients who require close monitoring and aggressive management. 2. Personalized care. Perioperative care is personalized to the patient's specific needs, taking into account their ASA classification and underlying condition. The ASA classification has practical applications in anesthesia care, guiding the selection of anesthetic techniques, anesthetic management, and perioperative care to ensure optimal patient outcomes. ASA and patient communication. 1. Discussing anesthesia risks. 1. Clear communication. The ASA classification facilitates clear discussions about anesthesia risks with patients, helping them understand their individual risk level. 2. Educating patients. It enables healthcare providers to educate patients about the potential risks and benefits of anesthesia. 2. Informed consent. 1. Ensuring informed decision-making. The ASA classification helps ensure that patients provide informed consent before surgery, understand risks and benefits of the procedure. 2. Patient autonomy. It supports patient autonomy, enabling them to make informed decisions about their care. 3. Shared decision-making. 1. Collaborative approach. The ASA classification supports shared decision-making between patients and healthcare providers, promoting a collaborative approach to care. 2. Personalized care. It enables healthcare providers to tailor care to the individual patient's needs and preferences. The ASA classification plays a critical role in patient communication, facilitating clear discussions about anesthesia risks, ensuring informed consent, and supporting shared decision-making between patients and healthcare providers. Conclusion. ASA classification in anesthesia. 1. Key tool in anesthesia practice. 1. Standardized assessment. The ASA classification is a widely used and accepted tool for assessing anesthesia risk. 2. Consistent framework. It provides a consistent framework for evaluating patients and guiding anesthesia care. 2. Systematic approach to risk assessment. 1. Objective evaluation. The ASA classification provides a systematic approach to assessing anesthesia risk, enabling healthcare providers to evaluate patients objectively. 2. Identifying high-risk patients. It helps identify patients at higher risk for complications, guiding anesthesia planning and patient management. 3. Importance in anesthesia care. 1. Anesthesia planning. The ASA classification is essential for anesthesia planning, enabling healthcare providers to develop a tailored plan for each patient. 2. Patient management. It guides patient management, ensuring that patients receive the most appropriate care based on their individual needs. 3. Communication. The ASA classification also facilitates clear communication with patients, enabling them to understand their risk level and make informed decisions. The ASA classification is a fundamental tool in anesthesia practice, providing a systematic approach to assessing anesthesia risk and guiding patient care. Thank you for watching. If you liked this content, don't forget to like to show your support. Comment and share your thoughts. Share with your friends and family. Subscribe for more exciting content. Your engagement means the world to us. Stay tuned for more.